we are on the muscular system, specifically on the upper extremity component. So before we get going with the specific muscles of the muscular system, which can also be found on the muscle charts or tables that I posted on the course website, what I'm first going to review is some components of the hand. Now, these aren't specific muscles, but it's good information for us to know. So the first thing I want to discuss is sensory innervation of the hand. Now, what that means is you have certain nerves in your body that will sense things in different parts of your skin and transmit that sensory information back up to your brain. For example, if my hand is right here and I put the pen on this part of my thumb, well, the palmar aspect of my thumb is innervated by the median nerve. So when my pen touches this part of my hand, the median nerve takes those signals and it brings it all the way up through my arm and back up to my brain to tell it that the pen just touched me. So since we're learning about all the different nerves that innervate the muscles in our upper extremity, I also want to include sensory innervation of the hand so we know what nerves provide sensation. So let's do a palmar view of the hand. So let me draw that out. Alright, and then I'm also going to draw a dorsal view. Alrighty. So remember, palmar view is an anatomical position. We're looking at the palm. Dorsal view is we're looking at the back of the hand. So we have a few different nerves. As I mentioned, on the palmar surface of the hand, that is going to be innervated by our median nerve. So let's color that in. And the median nerve is actually going to get most of this palmar surface of the hand, but it's only going to go up until half of the fourth finger. So that is median nerve. And remember, NN is the abbreviation for nerve. And the other, like half of the fourth digit and the fifth on the palmar side, that is going to be the ulnar nerve. And it's actually going to be the same way for the dorsal view, so it's going to get half of that fourth finger as well as the fifth finger, the pinky. Now, the difference is that the median always gets the palmar side, but a different nerve gets the dorsal side, and that's actually our radial nerve. So that's going to get all of this. And this is actually analogous to what happens in the upper extremities. So more specifically, actually in the forearm, pretty much everything on the anterior side is innervated by your median and ulnar nerves, or a branch of those nerves. And then for anything in your posterior forearm and actually your posterior arm, is innervated by the radial nerve or a branch of it. So take that information going forward. Now what we're going to do is, we covered sensory innervation of the hand. Now we're going to cover just muscle masses of the hand. There are lots of hand muscles, but I'm just not going to review them because that's beyond the scope of this course. So let's start. Muscle masses of the hand. And I'll draw a palmar view again. So we're going to draw that same thing out. Alrighty. So we have two main muscle masses of the hand. The first one is called your thenar muscles, and the thenar refers to thumb. So these muscles, you have like a mass of muscles right there, right on your thumb, and they are thenar muscles. And remember, that's a group of different muscles, but we're just not going to get into the specifics. And then you also have ones near your pinky on the opposite side, and that is going to be your hypothenar muscles. Sometimes people call them your thenar eminence and hypothenar eminence as well. So just for clarification, remember we're always talking about anatomical position. So your pinky is always going to be medial and your thumb is always going to be lateral. So I'm just going to write that out to make sure that we know what we're talking about with all of these drawings. Alrighty, so now we've covered the hand. What we're going to do next is we're going to start going through the upper extremity, and we're going to go proximal to distal. So we will start with the shoulder. Actually, before we move to the shoulder, one more thing that it's just like a fun fact. It's not going to, you're not going to be tested on it, but if we talk about, for example, carpal tunnel syndrome, if you've ever heard of that, that relates to our sensation of the hand. So if we have our hand, we have nerves traveling through what we call our carpal tunnel, which is, remember, our carpal bones are right around here, and you have a tunnel formed by a structure going over that allows nerves and blood vessels and stuff to travel through. And what happens is you have a different innervation on the palm of your hand. So it's still part of the median nerve, but there's a little aspect that pops up before the carpal tunnel and comes and innervates the palm of your hand. So that's important because if we talk about carpal tunnel syndrome, if we have a nerve traveling through our carpal tunnel, the only places that will be affected if the carpal tunnel is the cause of the problem is your fingers, because for innervation of your palm, remember, you have that little nerve that pops out before the carpal tunnel and innervates this palm. So oftentimes I'll have patients referred to me for carpal tunnel syndrome, and I'll ask them if they have any pain or numbness or tingling in their palm, and they'll say, oh yeah, it's my whole hand. Well, if it's their whole hand, including the palm, the issue cannot be the carpal tunnel anatomically. It just doesn't work that way because that's not where the sensation occurs. It occurs from places more proximally, not at the carpal tunnel. But I'll have a lot of patients who have those symptoms and they've actually underwent carpal tunnel surgery. It's often called a carpal tunnel release. Well, they'll just like cut through this like tissue that forms a ceiling over the carpal tunnel. And oftentimes I'll have patients who will come back and they'll be a lot worse after surgery. And not only was it expensive, painful, and it was inconvenient oftentimes to have to take time off work, for example, but it turns out that it wasn't actually the source of the issue. And my point in telling this story is just to emphasize why anatomy is important. You know, if we are careful with our patients and ask them questions like, for example, do you have any symptoms in the palm of your hand? You'll be able to rule out, oh, you know what? It's not coming from the carpal tunnel. It's coming from somewhere else. So let's look at sources more proximally. And that's what can be so valuable and why we really have to know our anatomy, because it helps us, if we end up working with patients, it helps us be able to treat them in the best way possible. All right, so let's move on to the shoulder muscles. So let's get started with muscles of the shoulder. I'm going to start with a posterior view. And actually, I'm going to do a few posterior views. I'm going to do one that's superficial and one that's deep so we can see different layers of shoulder muscles. So the first one is going to be superficial. So I'll start out by drawing our humerus, and then I'll draw the scapula. So this is just going to be like a super rough drawing of it, just because, you know, we went into our detail with the skeletal system. We don't really need to do that again. All right, so we're going to draw in the spine of the scapula as well, which will be right about here. And then remember, we're going to have our little acromion coming off to the side there, and you can't really see a whole ton of it, but that's just because of this posterior view we're in. All right, so we have the basics of that, and then we're actually just going to redraw that for a deep posterior view. So again, we're going to add in our humerus and draw in our scapula. And then we just gotta add in the spine of the scapula, going out into the acromion. All right, we're rolling now. So for all of these different views, we're going to look at different muscles. We're actually only going to look at one muscle in the first picture here, and that's going to be our most superficial muscle. It's going to be our deltoid muscle. Now, a little bit of extra detail about that. I'm always going to tell, or oftentimes for major muscles, I'm going to tell you the attachment points, like where the muscle originates and where it inserts. So those are the 2 points where the muscle is attached to bone. But you're not responsible for knowing that for this course. You're only responsible for knowing the action, the name of the muscle, and sometimes the nerve. So this muscle is going to be coming from the scapula as a couple different parts on the scapula, as well as the clavicle. So let's draw it out. So here is our deltoid muscle. It originates from different parts of the scapula and actually the clavicle anteriorly, and it's going to kind of form this cuff over the shoulder, and then it's going to insert on the deltoid tuberosity, which is that landmark that we found on the humerus. Now, this is going to extend anteriorly as well, but I'm just showing you the posterior view, but you'll be able to recognize it. It's like the largest cuff-like muscle that covers the shoulder. Now, if we were to peel that away and look at a deeper layer of the shoulder, we can look at what we call our rotator cuff muscles and one extra muscle that's related. So, oops, I forgot to write in the name of deltoid. Now I'm going to draw our first, actually, you know what? I'm going to write out the names of all of our rotator cuff muscles fun fact is people oftentimes will call them rotator cuff muscles, and I've heard that on like professional sports programs and things like that, but that's actually incorrect. It's cuff, C-U-F-F. So when we were looking at that group of muscles on your muscle charts, I made the background of each one of them gray, just so you can it'll serve as a little reminder that it's a group of 4 muscles that form one common structure of the rotator cuff. So let's write them all out first. Let's start with our supraspinatus. And there's a reason I'm writing them all out, so you'll see in a moment. Supraspinatus. We also have infraspinatus. We have Teres Minor. And then lastly, Subscapularis. Now the reason I wanted to write them all out first is because I want you to use this handy acronym, and it's SITS, S-I-T-S. So those are our 4 rotator cuff muscles. Now let's actually draw them in. So first we have supraspinatus, which, do you remember the supraspinous fossa, which is right here? Well, that's where our supraspinatus muscle sits, is right where that fossa is. So our supraspinatus muscle will be in our supraspinous fossa, and that's actually going to travel underneath the humerus and come over and attach, underneath the acromion, excuse me, and it's gonna go over and attach onto the humerus. So it kind of like goes from under here and it peeks out and attaches there. So that is our supraspinatus. Next we have infraspinatus, which is on our infraspinous fossa that we learned before. So it's right here, and it kind of covers this whole thing. So then this is going to come out, and it's going to, remember we're looking at the posterior view here, so we're gonna follow it out as it comes around and attaches here on our humerus. So this is one of those muscles that I think I'm just going to draw an outline for here. Perfect, so it goes from our infraspinous fossa all the way over to our humerus. Now that's our infraspinatus. Next we have our Teres Minor. And for Teres Minor, it's going to go from the lateral aspect of our scapula, and it's also going to make its way to that part of the humerus. So it'll go from about here to here. And then lastly, we have our subscapularis, so stay tuned for that one. We're actually going to draw that in a different view to make it a little bit clearer. So stay tuned for that. Let's add one more muscle into this posterior view, or actually 2 more. What I'm going to do is I'm going to add in a little spine here. So just like little vertebral segments here, just to simplify it. And our levator scapulae is a muscle that's going to attach from our spine to our scapula. So that's going to come here. And let me add a few more spinal segments in here. There we go. So it's basically going to go like this and attach onto our scapula. I'm going to review the actions in just one moment, so hang in there with me. The last muscle that I'm going to draw is not a rotator cuff muscle, but it sounds similar to one of the rotator cuff muscles, so it's actually called Teres Major, which is very close to Teres Minor. And it's going to go from the more inferior aspect of the scapula over to the humerus as well. Alrighty, so as a little review, we have our deltoid muscle. That's the most superficial, like cuff-shaped muscle. And then once we move beyond that, as if we were to flip it away, or move to the deeper muscles, which is our rotator cuff, these sits muscles, SITS, supraspinatus is in that supraspinous fossa going over to the humerus. Infraspinatus is in that infraspinous fossa going over to the humerus. And then we also have Teres Minor and Teres Major, connecting from the lateral edge of the scapula to the humerus. And then the other muscle we discussed is levator scapulae, going from here, the spine, to the scapula. Now that we have those all sorted out, I just want to review the actions that I want you to know for those. And remember, all of these muscles have lots of different actions, but let's go based on the location and the attachments of these muscles and try to figure out what they're going to do. Now, if we think about the deltoid muscle coming from the spine of the scapula to the humerus, if these muscle fibers shorten, what it's going to do is it's going to abduct the shoulder. And same with the supraspinatus. They're both going to serve as shoulder abductors. So that's AB, as in boy, ductors. Now, our infraspinatus and Teres Minor, oh, you know what? I actually just realized that I made a mistake. Our Teres Major shouldn't be drawn as it is. Teres Major is a little bit different. So how it works is it actually attaches to the front part of the humerus. So I might even... Well, I don't know if I'm going to redraw it, but what happens is Teres Major goes forward and attaches to the anterior humerus, whereas infraspinatus and Teres Minor attach to the posterior humerus. So really, we shouldn't really even be able to see Teres Major. So what I'm going to do is, hopefully you have whiteout, and if not, hopefully you know what I'm talking about in terms of it attaching anteriorly. I'm just going to white this out because I don't want us to get confused, because the locations of the attachments of the muscles will determine essentially the action of the muscle, which makes sense, right? Anatomy has a purpose. So I just whited out that area. And the reason I did that is because infraspinatus and Teres Minor attach from the scapula to the posterior humerus. So when these muscles shorten from this point to this point, it shortens. It's going to externally rotate the humerus. Okay. Now, Teres Major is a little bit different because it attaches from a similar place on the scapula, but it comes and it attaches to the anterior humerus. So the action is going to be the opposite of the infraspinatus and Teres Minor. So these two muscles are both external rotators, but your Teres Major muscle is actually going to be an internal rotator because it attaches to the anterior surface. So when these muscle fibers pull together, it's going to internally rotate the shoulder. So sorry about that mistake. Alrighty, so we've covered these posterior shoulder muscles. Now I'm actually going to do an anterior view. Now let's draw out our anterior view. Of the left shoulder. So we're gonna have our humerus, and then our scapula. Alrighty. You know, it's a super quick drawing. So for our anterior view, what we're going to have is that last muscle, the subscapularis muscle. It's going to come from the subscapular fossa here, and it's going to come around and it's going to attach onto the anterior part of the humerus here. So for that reason, it's also one of our internal rotators. Okay, so that's our subscapularis muscle. Now, one final muscle I want to add in is, I'm just gonna do it kind of in the corner over here. I just want to draw a little anterior view here again, and it's just going to be of a little guy. Oops, this is extremely rough. But basically all I wanted you to be able to see is the front of a person's torso. And how this is going to work is it is called our, this muscle is called our serratus anterior. It actually attaches from the medial border of the scapula, but it only attaches at that medial border. And it most notably comes around and almost kind of looks like this as it attaches on different ribs anteriorly. So that's kind of how you can know where the serratus anterior muscle is. And let's also write that out. Oops. Oh man, you know what I did is I used the same color for deltoid as I did for serratus anterior. My bad. Hopefully you can see that serratus anterior is this one right here and deltoid is that one right there. All right. So just as a quick review for these shoulder muscles, we have the deltoid that abducts the shoulder, the supraspinatus that also abducts the shoulder. We have our infraspinatus in blue, and then our teres minor that both externally rotate the shoulder. We have our subscapularis, which is down here in green, and that internally rotates the shoulder. And then we have our teres major up here that does the same thing. It also internally rotates the shoulder. And then lastly, we have the serratus anterior and the levator scapulae, both of which just move the scapula. So for all of these shoulder muscles, you know, some of these muscles are pretty small. Other than the deltoid up here, all of these muscles are very small in relation to the size of a person's body. And however, they can be really, really valuable for stabilization. So how we kind of learn about the glenohumeral joint, this joint right here between the glenoid fossa and the humerus, is that it's kind of like as stable as a golf ball sitting on a tee. Okay, so it's inherently very unstable just because the glenoid fossa is not very big compared to the size of the humerus. So it's really important for us to have ligamentous stability in like a joint capsule. Remember, we learned that those synovial joints have a good joint capsule, but it's also important in terms of stability for rotator cuff muscles here to help hold the shoulder joint together. Okay, so that's really what I want you to take away from this, is that we have a lot of shoulder stabilizers here that are small but important. Okay, so now we've covered these shoulder muscles, I'm gonna have us move to the arm next. So here we are with muscles of the arm. We're gonna do an anterior view and a posterior view. And here we'll do the, let's see, which arm do I want to do? I'll probably have us do the left arm. Alrighty, so let's get our scapula going. And then our humerus. Same thing in the posterior view. Alrighty. I think that's pretty much all we need. Oh, we need one little thing poking through right there. Alright, so for the anterior view, we're going to cover 3 different muscles. Let's start with our biceps brachii. Biceps brachii is going to attach from a couple of different points. So we're actually going to go with the name of biceps brachii. Let's look at that first. And it's called biceps brachii for a reason. So let's write that name out. Biceps brachii. See how that starts with a bi? Well, that stands for 2, meaning it has 2 heads. So for the 2 heads of the bicep, what it does is it attaches to the supraglenoid tubercle and the coracoid process. And what those 2 heads do is, well, this one will come down and this one will go over here. And it's going to, it's going to actually attach on the radial tuberosity. So I just want to end the humerus there, and then this isn't drawn very precisely, so ignore how that's drawn a little bit haphazardly, but they're both going to attach onto the radial tuberosity. So this head is going to come down here, and then this head is going to come and attach there. Okay, so that's our biceps brachii. Remember, there are 2 heads. You don't necessarily need to know the attachment points. I'm just drawing it in because it kind of makes it easier to visualize. I just want you to know that it will serve the main function of flexing the elbow because it crosses this elbow joint. So it's going to come from the scapula and attach onto the humerus. And so it's going to help us to flex the elbow. And then actually I want you to know that the main nerve in this anterior arm is musculocutaneous nerve. That's musculocutaneous. And you can reference that in your muscle charts that are posted on the course website. But yeah, let's just keep moving on to those 2 other muscles that are innervated by the musculocutaneous nerve as well. So our next one is going to be our brachialis. Actually, you know what? Let's save that one. Let's do coracobrachialis first because it's kind of convenient as the name sounds with coracobrachialis. It's similar because it attaches to the coracoid process here as well, but it comes around and it attaches onto the humerus instead. So that's what makes it a little bit different. Although it is still innervated by that musculocutaneous nerve, and instead of flexing the elbow, you can see that it doesn't cross the elbow joint, so it's impossible for it to move that. What it does instead is it actually flexes the shoulder. Okay. Now our last one that I had mentioned before is our brachialis muscle. And for that one, it's actually just going to go from the humerus down to the ulna. So it's a little bit different. Remember, the biceps attaches onto the radius, but this one will attach onto the ulna. So actually, I'm going to use a different color. It's going to go from the humerus to the ulna. So those are going to be our 2 points, and it's just going to look like that. I know it's kind of confusing with these like lines crossing each other, but hopefully you can see. What I'll actually do is I'll draw this green one in, just so you can see it a little bit easier, because it's getting a little crowded with our biceps there. Hopefully that's a little bit clearer, and I'll draw Brachialis in as well. And then bicep is most superficial anyway, so you'll be able to just see the outline of Biceps Brachii. And let me just add in Brachialis. Alrighty, so those are anterior arm muscles, and they're all innervated by musculocutaneous nerve. Now what I want us to do is move to the posterior view, and with that we're going to cover our triceps brachii. So let's get that going. Now, triceps brachii. Remember I said everything in the posterior arm and forearm is pretty much going to be innervated by radial nerve, or a branch of it? Well, this is no exception. It's going to go, it's going to also be innervated by radial nerve. And let me just draw, I also forgot to draw the distal end of the humerus here as well. Alrighty, so I have the olecranon coming up here a little bit superiorly into the bicep. Into the humerus, excuse me, because that's forming the elbow joint right there. Alrighty, so for the tricep, like the name sounds, you know how when we talked about the bicep, the BI means 2. So there are 2 different heads of the bicep. Here, the tri means 3, so there are 3 different heads of the tricep. One is going to come from the infraglenoid tubercle, and then the other 2 are going to come from different spots on the humerus, and they're all going to go into and attach onto the olecranon. So we're going to have 1, 2, and 3 heads of our tricep. And the action of that is it extends the elbow. So we have something, let's see, let's go back to our very beginning just as like a little bit of a review. So for our anterior arm, all of these are innervated by musculocutaneous. Our biceps brachii and our brachialis both flex the elbow, and then the coracobrachialis flexes at the shoulder. And then we have our triceps brachii, which is innervated by radial nerve, and that extends the elbow because it's on the posterior side. So now that we've covered the arm muscles, let's move on to the forearm. So now we are going to the posterior forearm muscles. So for this, let's start out with what we always do. We always start by drawing our base out. So we'll draw out some of the bones here. We're going to have our humerus, and then the olecranon is going to be coming up superiorly into the humerus. And then that part of the ulna will continue down inferiorly. And then we're going to have our radius that started up here. And then I'm just going to draw circles for our carpal bones because I don't want to draw detailed version of that. But then let me draw our hand. And I'm just gonna draw fingers, super basic. We're not talking about bones here. So that's a very simplified version of our hand just for our purposes here. So our first posterior forearm muscle is Brachioradialis. I'm just gonna label this is lateral, this is medial for our reference. Now let's draw in Brachioradialis. It's going to go from the lateral aspect of the humerus here, and it will go down and attach on the lateral surface of the distal radius down here. So it's going to come from here, just like that. Now remember, there are more forearm muscles than we're actually going to draw. So again, keep that in mind, just like we always do. And for all these posterior forearm muscles, they will all be innervated by the radial nerve or branches of it. Now, this brachioradialis actually crosses, it really crosses laterally, and the main action is it's going to flex the elbow, but it's still considered a posterior forearm muscle. All right, so next let's go to our extensor carpi radialis longus and brevis. So extensor carpi radialis longus is going to come from the this aspect of the humerus here, and it's going to go down and attach in the hand. And then extensor carpi radialis brevis is also going to come from about here, and it'll attach into the hand. So really, we're kind of considering it as one main muscle for the purposes of this class. So I'm just going to make this outline of it a little bit thicker. And for our action for this muscle, I just want us to know that it extends the wrist, and it's on the radial side. So that's kind of how I want you to remember it. Extensor carpi radialis longus and brevis. Our next muscle is extensor digitorum. It's also going to come from this lateral side of the humerus, and it's going to help extend the wrist. You know, also, as the name sounds like, it's also going to extend the digits. But that's kind of an extra one that we want to learn. So extensor digitorum. So remember, it starts from lateral humerus, and then it's going to make its way into all of these digits here. Alrighty, so that's our extensor digitorum. Our next muscle we have is our extensor digiti minimi. Extensor digiti minimi will come again from superiorly, and then it's going to make its way down into the 5th digit, or like the pinky finger. So the purpose of that muscle, along with other things, it helps to extend the wrist, but it also extends this 5th digit, this pinky finger down there. So extensor digiti minimi. Now, the same way that we have extensor carpi radialis, we're also going to have an extensor carpi ulnaris. Our extensor carpi ulnaris will also come from this part of the humerus, and it's going to come down and attach onto actually the fifth metacarpal there. But you don't need to know that. Just know that it comes down from the humerus and attaches here. And it's kind of analogous to the extensor carpi radialis on the other side. So that's our extensor carpi ulnaris. That also serves to extend the wrist. So pretty much all of these extend the wrist other than brachioradialis. And this last muscle, which is our supinator. So our supinator is going to have some attachments to the ulna, but it's going to kind of be wrapped all around the radius. So what I'm going to do is I'm going to do it in like our navy blue color. And it's really just going to be wrapped around this whole area. So that's where a supinator is. And the action of that is it supinates the forearm. Now, those are the only posterior forearm muscles that I want us to know. Let's move on to the anterior forearm. So for the anterior forearm, we're going to draw out two different bony structures because we're going to label things out, but we're going to do superficial and a deep layer. So for the most superficial view of the anterior forearm, let's start by drawing out, as always, our distal humerus right here. And then we're going to have the ulna coming through right here. And then the radius. Coming through over here. Now we're also going to have a deep, actually, you know what, let's draw out the superficial first. So I'm just gonna have this be a blob of carpal bones, and then we're gonna have our thumb and all of our different digits, because remember, we're doing a real simplified version of this. Okay, so let's start with these superficial structures. Our first muscle is going to be pronator teres, and pronator teres is going to come from this medial epicondyle on the humerus, and it's going to move to the radius over here. So the muscle is going to wrap around just like that. Now, before I forget, I'm going to label lateral and medial, and that is actually, I'm going to change things up, and I'm actually going to draw the deep version. So I'm going to label our words down here. We have pronator teres. Our next muscle, oh, and I can't remember if I said this, the action of pronator teres, just like it sounds like, is it pronates the forearm, and it's innervated by the median nerve. Now, if you remember, the posterior forearm is all innervated by the radial nerve or branches from it. The anterior forearm is almost all innervated by the median nerve or branches of it, except for two different muscles that have innervation from the ulnar nerve. So we'll get there shortly. But our next muscle is going to be Flexor Carpi Radialis. So Flexor Carpi Radialis will also come from this medial epicondyle, and it's going to go on down to our second and third digits down here. That is our Flexor Carpi Radialis, and that muscle is also innervated by the median nerve, and what it does is it flexes the wrist. Our next muscle is a little bit of a smaller muscle, and it's Palmaris Longus. Now, Palmaris Longus starts from same place, medial epicondyle, and then it makes its way down. It's actually a pretty small muscle, and it makes its way down to like the palm area, just like it sounds. And actually, not everyone has a Palmaris Longus. You can tell if you have a Palmaris Longus by like putting your fingers together like this and flexing your wrist and seeing if a little tendon pops out. I don't have one, so you won't be able to see it there. Now, our last more superficial forearm muscle is our Flexor Carpi Ulnaris. And Flexor Carpi Ulnaris will come from the same spot, that medial epicondyle, and it's actually going to come right around here to those carpals, those medial carpals and the fifth digit. So we'll make this a little bit thicker. And this is our last superficial forearm muscle. I forgot to say that Palmaris Longus is also innervated by the median nerve, and it plays a role in flexing the wrist. And Flexor Carpi Ulnaris is very similar to all of the rest of these, in that it does flex the wrist, but as the name suggests, it's innervated by the ulnar nerve, not the median nerve. Now, let's move to the deeper anterior forearm muscles, and that will wrap up our upper extremity. So this is our deep view. We're gonna essentially draw the exact same thing. Or try to, at least. Alright, almost done here. Okay, so our two deep forearm muscles that we're going to draw, let's do the first one. It's Flexor Digitorum Profundus. Our Flexor Digitorum Profundus is going to come from quite a few places. It's kind of going to come from like this whole area here. And part of here. So it's not going to go to the thumb. It's just going to go to these 4 digits right here. So ignore that little pink dot on the thumb. That was a mistake. There we go. For those last 4 digits. Now, it doesn't go to the thumb, and most of these that we're going over don't go to the thumb because there are a lot of very specific muscles that do go to the thumb, but we're just not going to review those at this time. Now, let's write the name out. Flexor Digitorum Profundus. Flexor Digitorum Profundus is actually going to flex the digits at the DIP joints, the distal interphalangeal joints. So that's going to be between the middle and distal phalanges in all of those 4 digits. And it's also going to be split in terms of median and ulnar nerve. The ones that go to the 2 most lateral digits will be innervated by the median nerve, and then the 2 that go to the most medial digits will be innervated by the ulnar nerve. Now lastly, we have our Flexor Digitorum Superficialis, and that's also going to be coming from here and kind of making its way down. Oftentimes in models you won't be able to see these when they're so proximal because they'll be covered up by the more superficial muscles, but you will be able to see them as they make their way lower. And it's going to go a little more proximally on each digit, because the role of this muscle is that it will flex the fingers at the proximal interphalangeal joints, which is in between the proximal phalanges and the middle phalanges, and it's innervated by the median nerve. So this is our Flexor Digitorum Superficialis. And that wraps up our upper extremity muscles.